Our final focus for this section on preventive health and the role of vaccines will focus on when and how often vaccines are to be given. This is often called the vaccine schedule. Here we'll present guidelines only for the dog and cat preventive vaccination schedules. There are many variations in the vaccine schedule used throughout the country. Let's start with the dog. It must first be restated that good preventive health includes a thorough physical exam, client education or answering the client's concerns and questions, appropriate lab tests to eliminate the possibility of parasites or other internal diseases, and then the appropriate vaccines given at the appropriate times. Remember, at birth, the puppy or kitten is bestowed with maternal antibodies that provide protection for the first month or two. Between 6 to 8 weeks of age, the puppy should have a physical exam, a stool check and necessary dewormings, and the first puppy shot. If the puppy is 6 to 8 weeks of age, it is appropriate to be using the standard distemper vaccine. This is the vaccine that will be repeated every 3 to 4 weeks until the pup is 16 weeks of age. The important thing to remember is the interval between vaccines is 3 to 4 weeks, and the finishing age is at least 16 weeks of age. Newer vaccines, however, may prove to be more effective and create enough antibody protection as early as 12 weeks of age. Typically, the rabies vaccination must be given by a licensed veterinarian, and the dog or cat must be at least 12 weeks old. Cats have a very similar program. The principles remain the same. The FVRCP combination is given every 3 to 4 weeks until the kitten is 12 to 16 weeks old. We let the maternal antibodies fade out and generally begin vaccinating between 7 to 9 weeks of age. Like the adult dog, the adult cat only requires 2 FVRCP vaccinations to acquire adequate protection. The feline leukemia vaccine is given to the kitten and then reboosted in 2 to 3 weeks. It is then given annually thereafter. The rabies vaccine is given at 12 weeks of age and then reboosted every 1 to 3 years depending on the state. Well, that's a quick tour of dog and cat vaccinations. If you understand the principles and the basic diseases we are trying to prevent, you can productively offer valuable information to pet owners. We'll conclude this section by discussing 10 tips to consider when handling vaccine. 1. Always keep vaccinations refrigerated. Many vaccines are living organisms that must remain refrigerated during shipping and daily storage. They can be individually warmed in your hand prior to administration for the comfort of the animal, but should not be left at room temperature for extended periods of time during the day. If vaccine is left at room temperature for an extended time, or it arrives unchilled from the distributor or manufacturer, contact your veterinarian as to the appropriate protocols to follow. Never freeze vaccines, as this will likely significantly diminish their effectiveness. 2. Always use a new needle and syringe when mixing and administering vaccines. Sterile but reused syringes may have residual amounts of disinfectant or antibiotics still in the syringe that would very likely deactivate a modified live vaccine. 3. Always reconstitute those vaccines that require mixing an adjuvant or diluent with the vaccine just prior to injecting. These should not be mixed until they are needed. Storage in the refrigerator after mixing is not a safe, acceptable option. To properly mix these vaccines, withdraw all of the liquid adjuvant or diluent and transfer it to the dehydrated vaccine vial. Gently mix till all of the dry vaccine is reconstituted. Withdraw all of the product in this single-dose vial. After expelling all of the air from the syringe, the vaccine is ready to be injected. 4. Multi-dose vials should always be mixed prior to withdrawing each dose of vaccine. This prevents the vaccine components from settling out to the bottom of the bottle, making the last doses withdrawn more concentrated than the first doses. 5. With each vaccine, follow the manufacturer's guidelines for how a vaccine is to be given. A subcutaneous route of administration should be used instead of an intramuscular injection whenever this is an acceptable option. This technique attempts to place the vaccine between the skin and muscle layers. This is often much less painful than depositing the vaccine into a muscle. 6. Never mix vaccines that are not expressly designed and produced to be mixed. Inappropriate mixing might deactivate the effect of the vaccine or create a heightened reaction in the patient. 7. Do not administer multiple vaccines into the same area. This can cause tenderness in an area and even adverse reactions. Giving vaccinations in multiple areas helps to localize and pinpoint adverse reactions, including vaccine-induced sarcomas. 8. Injecting a vaccine relatively slowly will generally create less discomfort for the patient. A 22-gauge needle is generally recommended, but some veterinarians prefer different needle sizes. Small puppies and kittens may benefit from a smaller needle size to reduce any injection site pain. 9. Rubbing the area after the injection has been given often helps to spread out the vaccine injected, making it less irritating. Most pets will appreciate the added attention also. 10. Accurately record the type and brand of vaccine, along with the lot and serial number, into the medical record. This information must be documented for all rabies vaccinations. New removable labels make tracking this information very easy.